How to break the vicious cycle of back pain. It should be crystal clear to the reader by now that the real cause of chronic nonspecific back pain is the dysfunctional motor planning of the body's core muscles. The medical establishment has made available to back patients a rather impressive array of physical modalities, along with a considerable selection of medications. Alas, all these tools are only able to provide temporary relief when they work. The reason is that they only address the symptoms but not the cause of back pain. In other words, all the attempts at dealing with this problem are failing for lack of a solution to the real problem. The vicious cycle of chronic back pain can only be broken by fixing the dysfunctional motor planning of the body's core muscles. Under the care of a physical therapist, the patient goes to a back school, a protocol usually lasting 4 to 6 weeks. During this phase, the patient is instructed in all aspects related to avoiding future back pain episodes. The patient is taught how to perform his activities of daily living with neutral posture, proper body mechanics, and good ergonomics, as well as stretching activities, plus stabilization and strengthening exercises. The satisfaction rate after back school is extremely high. Unfortunately, after a few weeks or months pass, most patients go back to their old habits of doing things with improper posture/body mechanics, as if they had never attended back school. Of all the tools made available to back patients, the most appropriate item that does a decent job of helping people retrain their posture/body mechanics is a thoracolumbar orthosis, or a back brace. This type of brace holds the trunk in as neutral a position as can be, thereby preventing the wearer from slouching and performing tasks with bad body mechanics. These braces are usually prescribed to people who just went through spinal surgeries. One of the most challenging tasks as a physical therapist is to try to motivate these patients to wear their back braces. People will complain about how uncomfortable, bulky, and cumbersome they find these braces to be. They usually do not want to be seen in public wearing them either, since they find them to be unattractive and seem to attract unwanted attention. For the past years, I have been looking for a product that would do the job of a back brace while being accepted by people who need to wear them. I have finally come up with a product that is easy and comfortable to wear, attractive, inconspicuous, and quite affordable. The product is called the Posture Saver, and this is a garment that is worn like a vest. It has 2 bands of fabric that surround the shoulders, and 2 straps of elastic fabric that run from the bands of fabric, crisscross in the back, and finally attach the lower abdomen area via hook and loop Velcro. When the elastic straps are pulled forward, the shoulders retract or are pulled backwards, putting the trunk in proper neutral position. The amount of tension on the shoulders can be adjusted by pulling the straps to a desirable level, hence making sure that wearing the Posture Saver is always a comfortable experience. How will the Posture Saver help? By wearing the Posture Saver and adjusting it to a desirable position, the trunk is held in proper neutral position. So whether one is sitting in front of a computer screen, painting a house, working on a car, or performing surgery, the trunk is prevented from bending forward in an inappropriate fashion. When bending inappropriately while wearing the Posture Saver, the bands of fabric surrounding the shoulders and the elastic straps cause a mild increase in pressure around the shoulders and the mid-back, acting as a warning system that prevents the wearer from slouching and improves his postural awareness in the process. Since the act of slouching can become an automatic reaction if repeated enough, as if a computer program has become imprinted in the brain, the Posture Saver will be able to modify how the brain reacts so that proper posture becomes an automatic reaction, replacing the slouching reaction. Repetition is the mother of skill. Anybody willing to become a great dancer, like Michael Jackson, for instance, can, providing he is willing to train for countless hours. Michael Jackson built a dance studio in his house, and he would practice for an average of 12 hours a day for years until he became the dancer that we all enjoyed. The act of repeating a movement will reprogram the brain to recognize that this specific motion is only to be performed the way it has been repeated. In simple terms, by suppressing the act of bending forward with improper posture and substituting instead the good habit of performing activities of daily living with proper posture and good body mechanics, we reprogram the brain to change its old, deleterious postural reactions, hence eliminating the real cause of nonspecific chronic back pain. Several people have mentioned that I should change the name of the posture saver to the invisible brace. By sewing the straps into the garment, the posture saver looks like a regular vest or shirt, thus attracting no attention whatsoever from other people. The importance of good posture. We have all heard and or used the expression a straight back. In real life, there is no such thing. With neutral posture, our spine has three natural curves. First, an anterior curve at the neck level. Second, a mild posterior curve at the thoracic level. And third, an anterior curve at the lumbar level. When you are standing up with perfect posture, you can literally draw a straight line that runs from the earlobe, through the shoulder, the hip, the knee, and finally the ankle joint. From a biomechanical viewpoint, with neutral posture, all the core muscles are in their most optimal position. They are properly relaxed and, when solicited, work most efficiently. With an erect and neutral posture, one looks taller, more confident, and also more attractive. This is why models do not slouch on the runway. The act of breathing is also easier and more efficient with strenuous activity, since the diaphragm and other breathing muscles work better. Performance and endurance are improved, as fatigue and the likelihood of muscle injury are reduced. A Swedish scientist by the name of Alf Nachemson conducted a study where the intradiscal pressure between the third and fourth lumbar vertebrae was measured for different body positions. As shown on the graph, where the standing position is taken as the baseline and given the value of 100%, standing and bending forward increases the pressure by 50%, while standing and bending forward while carrying a 22-pound weight in each hand more than doubles the pressure. Surprisingly, sitting and bending forward almost doubles the pressure of the spine, whereas sitting and bending forward with a 22-pound weight in each hand nearly triples the amount of pressure. Given this information, it is safe to assume that when it comes to chronic back pain, posture must become the most critical factor to consider.